New figures in overnight show Los Angeles County is the first county in the country to record 1 million COVID cases. Officials say the county's current surge started in early November, shortly after a loosening of restrictions. Since then, rates have increased by 1,000%. The county's public health director says officials would consider tightening restrictions if numbers continue to rise. Wednesday marks 1 year since the first COVID-19 diagnosis here in the U.S., and we are still learning more about the virus. To help us understand the latest developments, let's bring in our medical expert, Dr. Arnold Baskies. He's the past chairman of the National Board of Directors of the American Cancer Society and chair of the Global Cancer Control Advisory Council. Dr. Baskies, good morning. Thanks so much for being with us as always.
Good morning, Ted.
Certainly a grim milestone we were just talking about there in L.A. County, and new research from England shows that those with antibodies may still be able to carry and spread the virus. So what does that tell us?
Well, Ted, people who have had COVID-19 are highly likely to have immunity for at least 5 months from a personal point of view. But there's evidence that those folks who have antibodies may still be able to carry and spread the virus. The study you're talking about from the UK shed some light on these questions. It's now clear that reinfections in people who have had COVID already from a past infection are rare. It's also possible, however, that folks who have so-called natural immunity may still be able to carry the virus in their nose and throat and could pass it on to people who have not been immunized. So even if you get the vaccine, just from the point of view of your neighbors, friends, relatives, etc., it's a good idea to continue to social distance and to wear a mask.
Yeah, it sounds like we're just going to have to keep doing that for now. Dr. Baskies, we've heard experts recently predict that COVID-19 will become endemic rather than a pandemic. What does that mean?
Well, we're getting now into the public health and vocabulary part of this infection, which isn't such a bad thing. An endemic infection occurs when an infection which persists in a population doesn't any longer wreak the same havoc as it did when it was new. So examples of endemic disease in the United States are chickenpox or sexually transmitted diseases like syphilis. They are endemic. In other words, they're rattling around in the population, not causing huge outbreaks, but they're still there. By the way, the initial flu strain from 1918, that strain is still around. We just don't get as sick from it anymore. An infection that starts out as an epidemic or a pandemic will eventually do one of two things. It'll either die out, sometimes resurging, or it will really reach a low level of transmission and stay there. In other words, it will become endemic. In other words, living in the population but not causing a problem. The likelihood is that COVID will remain out there for a considerable period of time, but it will become less and less of a problem for us from the point of view of being able to spread from person to person. All the more reason to make it endemic, to keep it from becoming another problem in the future. And the way we do that is get a vaccination program started and effective.
All right, Dr. Baskies, thank you so much for joining us this morning and sharing your insights with us. We really appreciate it.